Thank you. So now, the last panel is about what we can do. And as I said earlier, this is not a one-day stop. We're not coming here just talking heads, people just exchanging ideas, but really how can we go forward? And I think that's happened a lot amongst the panelists this is something, but I think we can all make a difference. So I'd like to call the next panel up, and I think it's going to be quite a lively panel, and moderated by Natasha Muller, and I look forward to see how we can all help. Yes.
I think now we have all our panel speakers. Thank you, Sofyen, for joining us. And we've got Rabih and Joanna on screen, or will be coming up. So it's really an honor to moderate this panel. There are some super strong speakers, and generally all the speakers today have been, you guys are like mental health rock stars, and you've done an amazing job of bringing this conference together. So I'm going to just talk a little bit about some of the themes that have come up to put this panel into context, because there's been a lot of big words and big ideas being thrown out. So I think one of the things that really came up was the holistic, interdisciplinary nature of mental health. And I think when you're taking action on it, you really have to look at a systems change approach. And by systems change, I mean looking at transforming the policies, practices, power dynamics, government structures, social norms that lie underneath mental health. You know, we talked about the social determinants of health. Pamela, your opening keynote was amazing. Looking at poverty, access to affordable housing, gender, sexual rights, structural racism, and health inequities, and particularly for women and girls, issues like freedom from discrimination and violence. And across the panel, you're all working in different themes and in different sectors. So we have the private sector with Franzisca's work, public sector, which Rabih will talk about, multilateral and NGOs and corporate philanthropy. And it's at the national level, community level, in fragile contexts, in community settings, all of which are really complementary and are part of this overarching puzzle to address mental health. I think we also heard a little bit today about some of the barriers that we face when addressing mental health. So I'm going to flip that around and say those are actually opportunities for action. We talked about funding and financing, which is absolutely critical. Mental health has been historically underfunded for years. I think, Rasa, you said 0.4 of global health funding goes into mental health, which is shocking. But acting and action is not just financing. It's also important that we consider advocacy and lobbying, that we consider a policy reform and governance structure. And also when we're talking about women and girls, that they have a gender lens when reforming policies. Research, training, skills, raising awareness, campaigning, all super important. And all of these pillars of action need to be addressed. I think, you know, mental health has always been critical for our individual and collective ability to thrive. And with everything that's happened with COVID, I think it's really time that we go from talk to action. So I'm going to quickly introduce the panel, and then they're going to go into more details about their work in the first question. So on screen we have Rabih Chammay, who's a psychiatrist and has extensive experience working in public mental health, refugee mental health, and strengthening health systems. He's currently the head of Lebanon's National Mental Health Program. We have Franzisca, who is also a psychiatrist and founder of Toises Center of Psychiatry and Psychotherapy in Switzerland. It's a major private provider of personalized mental health care for all ages and types of mental disorder. Sarah Jeffery, who is head of health at Vitol Foundation, which includes mental health and adolescent health as strategic pillars. And Sarah started her career as a nurse in the UK before transitioning into international development and managing health programs in fragile contexts. We have Joanna, who is a health specialist with UNICEF HQ, and their focal point for mental health. Her work supports national planning, delivery, and evaluation of health and counseling services for children and adolescents, working through schools, digital platforms, and primary healthcare settings across low-resource settings. And we have Sofyen Khalfaoui, is that how you pronounce it? Great. Who is Zurich Foundation's Mental Wellbeing Program Lead and has worked globally on the design and implementation of child protection, psychosocial support, and education programs for children and youth in both emergency and non-humanitarian settings. And I think actually we have a video No, we don't have a video. We
There's
do
a
it later?
video. I didn't know if it was for now, but...
Okay, or do you want to do it later when you talk? Okay, we'll do it later.
Yeah, okay.
Okay, perfect. So I'd like to actually start with you, Rabih, because we had a really interesting discussion this morning, and it kind of highlights some of the discussions we had today, which is about tensions in mental health and the intersectoral nature when you're trying to create action on mental health versus seeing mental health as a standalone and what your circle of influence is. So I wonder if you could expand a little bit on that and kind of the work you're doing in Lebanon on the National Mental Health Strategy.
Sure. Thank you, Natasha. I'd like to start by saying how much I would have loved to be there in person with you. However, due to a family emergency, I had to change my plans last minute. Still, I'm very grateful for the opportunity to be able to participate, and a big thank goes to Giving Women and the organizing committee for this conference. I'm very happy to see that mental health is going beyond the usual suspects and beyond the usual interest of usually the health sector. The question of a call for action for mental health is not an easy one for me. And I'm sure many relevant areas for action have already been highlighted in the previous panels. So maybe instead of answering from my position as a mental health policymaker and implementer, I'll start by laying down the tensions that underpin such a decision and that might have different implications for different participants here today. First, it really depends on the position you're in. Are you a UN agency, an INGO, a government agency, a donor, a person with lived experience? And do you work directly in the mental health space or in a sector that is relevant for mental health? And by that, I mean almost all sectors: education, gender equality, poverty, peace building, to name a few. Second, within the space of mental health, the areas of actions are wide and diverse. Are we talking about policy, services, prevention, social determinants, advocacy, funding? So if you ask different mental health professionals in the global mental health field, you'll probably have full agreement on what are the areas that are important to influence positively for changing the mental health of the population. Let's call that the circle of concerns. Now, if you ask the same group of people what they can do to move the needle forward, you'll have a smaller number of things, and let's call that the circle of influence. Having a circle of influence that is smaller than the circle of concerns is a common thing in all areas. However, in mental health particularly, there isn't full agreement or a full consensus on what exactly goes in this circle of influence. And I think this stems from a lack of conceptual clarity around what we mean by mental health, which would be a third point of tension for me. And just for the sake of contrast, we don't hear people saying, I'm a physical health advocate. It would be more focused either on a disease, such as HIV or diabetes, or a group of diseases, such as cancer or NCDs, or a domain of health, such as maternal and child mental health. And even within these specific areas, you'll find different people working on different things, such as prevention, policy, services, and quality. To take it to a different level, all countries, with no exception, have full-fledged ministries for health. And by that, they mean physical health, with many departments and many collaborations with other ministries. However, when it comes to mental health, most countries don't even have one person as a focal for mental health. Yet the assumption is that this one person should figure out and implement whatever there is to be implemented to improve mental health. I happen to be in one of those countries that have a program for mental health, working with a team, a great one, may I add. So if you ask a person in my position, what is the call for action, I bet the answer will be very different from a person working in the donor space, the human rights space. But this does not mean that there's a void on what should be done. And if we're working in the mental health space, we have the WHO Global Action Plan for Mental Health that laid down a clear way forward about some of the most urgent priorities. If you work in adjacent sectors, and you're interested in improving mental health, especially for women and girls, in addition to supporting the development of a responsive mental health system for all, working on advancing gender equality, addressing sexual and gender-based violence, supporting educations for girls, and raising the minimum age of marriage would also contribute hugely to improving their mental health. Personally, I, of course, have a vested interest, and I have an idea about what would be the most impactful way to moving the needle on a national level on improving mental health for all, including women and girls, building on what we've learned in Lebanon in the last 8 years. But I guess I'll leave it at this point for now and open it for the also panel to contribute and reflect on this, and maybe we'll get at this at a later stage.
Yeah, perfect, Rabih, and thank you for sort of laying the scene a little bit. So I might open to both Sofyen and Sarah. You're in the corporate philanthropy sector, you're funding these. So how do you navigate that space, knowing what to fund? How do you, decide what to go for, where to put your energies and efforts?
Thank you. So from Vitol Foundation's side, we have a proportion of the health portfolio that is allocated directly to kind of mental health. And then a significant proportion of the health budget that's allocated to more kind of generalist health traditionally, so primary healthcare access, adolescent sexual reproductive health, etc. For us, I think the challenge is, as you say, how do you know who to work with? How do you know who to work with when the reality is that many kind of foundations have small teams and are funding across subject areas? So our network of kind of experts whose advice we seek is really important and really helpful. We ask our partners to suggest partners that they in turn think highly of their work. What we try really hard not to do, but it's not always easy, and I think that's why this event is really fantastic, is to broaden the network of kind of partnerships and voices that can make suggestions to us. From a kind of call to action perspective, which kind of answers the question a little bit, the reality is that even though we have a kind of localization agenda and we are actively supporting more local organizations as much as we can, there is a bandwidth issue to this. And so we're also kind of supporting intermediary organizations like kind of the SHM Foundation. And as a funder, because we understand what their due diligence process is, we trust them. Like, it's not for me to select which mental health organizations are doing the most appropriate work that's the most impactful in the context. It's for me to kind of learn from partners, identify organizations to support who can inform me. But that's kind of what that's trust. And we've talked about this, about trying to be as trying to kind of administer a trust-based approach to your giving, and to try and be as flexible as you are able to be within your own limitations to your giving.
Yeah, I totally agree. And just on that note about trust, I think it's also, and perhaps we can touch on it later, the trust between grantees and grantors, which is a problem, I mean, when you're giving generally, but with mental health, it's very important that we include those who we are trying to help on the ground and lived experiences we heard in the previous panel. So, Sofyen, how about you?
Yes, thank you. And I very much relate to what you said, Sarah. The thing is, first of all, the Zurich Foundation is the corporate foundation of the Zurich Insurance Group. It's been half century now of existence, but it's been a few years that it really got back on track. And then we have identified several thematic pillars: this mental well-being, climate change, and social equity. And we also have several bridges to connect those pillars together. We also engage in humanitarian settings, and this is in the making. This being said, when we speak about mental well-being and mental health per se, when we think about the whole range of possible programs and interventions, we really commit to prevention, promotion, stigma reduction, anxiety management. Actually, we try to do everything it takes to help youth, who is the target group in this case, to not reach a crisis point. And I already anticipate a question that you may ask later, but the success may simply materialize in someone who's 16 years old, for instance, and who's empowered enough to say, I'm not okay and I need support. But to get to such a simple outcome, it takes such a, I would say, a multi-layered, interwoven, complex set of approaches that we try to engage with several partners to do this. And to connect to what you said, Sarah, as well, there is, for us, really paradigm shift from having grantees, awardees, partners, and then the relationship is only transactional, and then we tick a box, and then we have a final report, and we move on. When I joined the Zurich Foundation last January, we were entering a reflection about how we could, together within a wider community, enter in a sort of thought leadership type of movement and system, that to respect the sovereignty of any actors in what they can bring, its expertise, knowledge of a context, youth groups, academia, multilateral actors, but also thinking from the perspective of a foundation that we have a key role to play that goes beyond finances. But it also puts us, as you said, in a very humble position, because we have to say, well, it's not in our control, we're not anymore the master on board, we have also to go by what comes from the outside and embrace it in a very consistent manner. This is very much of a challenge for mental health and mental well-being, because that's a very invisible sector. It's really hard to say this is, the milestones we're going to go through and commit together. But we really believe, and Joanna can speak more about that in a second, about the power of connection to change the system. Changing the system will never happen alone. So we're just, as corporate philanthropists, one part of this bigger puzzle.
I think it's beautifully said, and I think the mental health system is much more connected, than it was a few years ago. So it's been great to see. So Joanna, do you want to jump in there and speak a bit more about that? Oh, I don't know if you're on mute.
Sorry, yes, I was. Thank you so much, and same with Rabih, just to say thank you so much for allowing us to participate, even if virtually. It's really good to be part of this very important dialogue. And I think Sofyen brings up a good point. Rabih also has brought up a good point, which is, those who are engaging in the conversation now, it's expanded, and that's been an encouraging thing to see, where stakeholders and systems that might not have usually seen mental health as their primary area of responsibility are now thinking about how they can practically contribute and take action. And from where I work and I sit, I've seen that change, engagement not with only governments, but also private sector partners like Zurich Foundation and others has really increased. For us, especially the engagement of young people, girls and women also, not only to tell us about their experiences, but really in working with us to shape the solutions and the systems for the services they need. And what you just talked about is the talking that happens between different systems, health, education, social protection, even urban planning, dialogues about homelessness or discrimination. Those things coming together so that the services and the support for a young person, if we think about it at the end of the day, is more comprehensive and less disjointed. I think these are all the kind of talking that is still needed to happen for us to drive the action that's required. That it's not just the health system's response, even though obviously as health sector, we also need to very much work on strengthening the quality and access to services. And I also like what I think Sofyen and others have just touched upon, that if we think about what success looks like, the number of needs and gaps can sometimes feel so overwhelming or so daunting. But for me, success would probably look like that every young person has at least one supportive adult or peer in their life that they can connect with, that they can feel a sense of belonging and acceptance from, that they can turn to for a listening ear or a safe space, and that can guide them in moments of distress, which all of us will inevitably face.
That's amazing, Joanna. And I'm going to pick that topic of success up afterwards, because I don't think we're quite there yet in an idea of what a mentally healthy world looks like. At least I don't. But before we do, I'm going to ask Franzisca we're going to slightly shift our focus to the private sector, because what you are doing is phenomenal. It's a really multidisciplinary approach to care for mental health issues.
Thank you, Natasha. Yes, actually, I was working, before I started to build up the Toises, I was working on the public sector. And I was heading a team treating people with psychosis. And in Switzerland, we can do psychotherapy, which is quite important. It's not just about medication. Actually, we can treat with psychotherapy. I think it's half of the treatment. And actually, I saw that the whole team hadn't enough time because we had too many patients. We had enough time to do psychotherapy in a good way, if you want. And we were teaching about it, so it wasn't fit for me. And I was wondering what I could do to do more about that. And in Switzerland, we have usually this multidisciplinary team in the public sector. And so I was building it up in the private sector. I found the model. It wasn't that difficult, actually. And it started. We also thought we really didn't want to make waiting lists, which is quite usual here in Switzerland. And one knows that if you wait for 3 months or even more, then it just gets worse. Usually it has consequences on the family life, on the social life, etc. So that was the bigger challenge than finding the model, actually, not to have waiting lists. So it started in 2009, and then we had to grow up very fast because we had a lot of people, patients coming. And now we have 8 clinics, mainly in the French-speaking part, a little bit in the German-speaking part. We have altogether about 350 therapists, and 400, more than 400 people working together. And the multidisciplinary team consists of psychiatrists, doctors, psychologists, they are very important, and social workers and nurses. Actually, a little bit less numerous, the last 2 ones, but very important because if somebody is very ill, he doesn't treat the administrative part of his life, for example. The social worker really makes a difference. We don't just talk about what doesn't fit in life, symptoms, and try to understand where the person stands, but the social worker really concretely helps.
I think it speaks. I think Peter was mentioning that in an earlier panel about the medical, the psychological, and the social all coming together, and that's a big part of the care that you provide at Les Toises, right?
We are all in the same house. Specialized for children, adults, elderly people, all together. And we just share our knowledge and our resources. We get organized to be connected around the patient. And then we have several kind of interventions. We can do individual, family, psychotherapy, psychoeducation, group therapy, etc., etc. So we just choose the space we need.
And just the last point, I think you also mentioned transfer of knowledge and training and skills, and you had like a few people that found your model in the MENA region, for example, and now you are doing online training so that this model can be replicated in other settings.
Yes, so we are recognized in Switzerland for training. And just a few months ago, actually, a psychiatrist in Tunisia, she contacted me and she was wondering if we could work together. She came to us, we met, and now we start we get each other to know a little better, and we start training in Tunisia. And she wanted to have psychotherapy, actually, and she chose for psychotherapy for perinatal situations, and we have a specialist. He can do that. We have groups in our team who do that here in Switzerland, and so we bring them over, and I'm very happy to get better knowledge about how she does, what she does, and I think we can adjust, and I'm really happy to get out of our path here in Switzerland, because we like just to get open and
and as we heard earlier, quality care and access to it, there just isn't enough available, and waiting lists and definitely a big problem. So I'm going to come back to this question of success, and Rabih, maybe I'm going to ask you a little bit about that. You're designing the mental health strategy in Lebanon, and I wondered, what would success look like to you? Have you achieved it? Like, in your action, like what would that kind of vision be?
Wow. I don't think there's anyone who can claim that they've attained success when it comes to implementing mental health programs or improving mental health of population, especially at a national or global level. As you may know, there was recently a release of the World Mental Health Report, and the lack of coverage is still astonishing. Still, 9 out of 10 people globally are not accessing mental health services that they need. So in terms of, I would say in terms of success, I was listening to the panelist colleagues, and I think there are a few ingredients there. I mean, I noted a few words that I would like to share. Trust, partnership, system support level, use, expanded stakeholder, biopsychosocial support, multidisciplinary approach, private sector involvement. I think the ingredients are there, and in most cases, we know what needs to be done, and we know how to do it. But what I rarely hear about is how are we as an international community, whether UN agency or the donor community, really engaging with national governments and trying to support the systems in place, as hard as that might be. And I think there's enough rationale to do that. And if you allow me, Natasha, I'll give a bit of an example of how things have been for us in Lebanon and why this might be a good thing to consider, especially that it doesn't cost that much. So in 2014, building on the humanitarian response for the Syrian crisis, the Ministry of Health in Lebanon decided to have a long-term vision to establish the National Mental Health Program with the support from WHO, UNICEF, and International Medical Corps. Directly after that, we published a 5-year strategy for all people living in Lebanon to reform all the system and to make sure that everyone, host community and refugees, receive the care they need within the same system. The only issue is that despite the fact that the program is the officially governing body for the system and that it has the power to convene and align stakeholders around one table, there's still no government budget for it, especially with the economic crisis. And most of the staff and the team are project-based, recruited through our partners, seconded to the program with very short cycles of funding. And I'll spare you the administrative and logistic complexity of such a setting. Very, very few donors, such as AFD, the French Agency for Development, decides to directly invest in institutional support and to support governing structure. Even though everyone sees the value of such governing bodies, yet whether because of the lack of the structures within the humanitarian system or the donor space, sometimes it's related to lack of trust in the government, but there are issues that can be solved around that. I don't think up until now, proper system strengthening is viewed as, and excuse my language, but I think this would convey a lot to donors. It's not a sexy thing to invest in.
Definitely not.
It doesn't really show numbers, it doesn't show direct impact. It's a long-term investment. But in my views, having been working in this space in Lebanon and supporting other countries as well, I think it's one of the most impactful decisions and investments that can be done in a country at the system level, because it creates leadership, vision, convening power to get all those actors around one table, around one vision, around one strategy. So if there's one call for action for me for investing in system strengthening, and more specifically, it would be to support local governments, wherever you are working, in the space you're working in, slowly to establish this governing entity and to make sure that it is well-resourced to build their capacity, even if it's for 1 to 3 years. I promise you that this will be one of the most impactful investments when you look back, but 5 to 10 years. Don't expect results in 1 to 2, 3 years.
I would definitely agree as a donor myself. I really like and enjoy funding advocacy, the unsexy stuff that really gets the work done. But I have to say, it's challenging from a donor perspective. Like, how do you find the pinpoints within a national system to fund, you know? So I think 100% the trust is an issue. We talked about it as well, but actually finding the areas to fund from a funder's perspective, really, really, really tricky. So on that note, I'm actually going to turn it over to you, because we discussed a little bit about transparency in the funding sector and some of the challenges, that we don't really talk about it that much. So I wondered if you could, we're going to move from successes to the challenges that you've had in your work and sort of the lessons learned. What can we take from that in when we want to act on mental health? Sorry, there's like something flying in my face.
Okay, sure. So from our side, one of the challenges that we have, and we're having, and we're figuring out, if we're really honest, is at the Vitol Foundation, we fund across 5 program areas. Health is one. We have education, livelihoods, water and sanitation, and humanitarian. We know from the conversations we've all had that mental health and a kind of positive mental health and an effective mental health program actively improves all of the measures of success across these different kind of program areas and across these sectors. But that doesn't necessarily make it easy to communicate that either within a team, if you're trying to look at metrics, because it's not always easy, and certainly not kind of externally to other funders. One of the things that we have started to look at, and welcome any comments and suggestions and support on how to do this better, is to try and think about what can we do with the luxury of the position that we're in. You know, we're a corporate foundation, we're really flexible, we're able to take risk, we're allowed to fail, we're actively told that if we don't fail very much, we're clearly not being risky enough. We are well aware that other funders and funding organizations have their own kind of internal constraints and need their own evidence base in order to lobby themselves internally for how to bring kind of mental health and how to bring other agenda items kind of into their kind of portfolios. So a challenge is how to communicate better across the funding sector and how to be better informed about the gaps we can fund that may support other funders who may come in at a later stage with the evidence that they need to then in turn advocate internally. So I think that for us is a big challenge. I think from a transparency kind of perspective, we like the idea of talking about failure, but we're not actually very good at it. And as soon as we try to talk about failure, we hit the stumbling block of wanting to protect the organization who, you know, you didn't fail if you learned from it, but you might not have met your kind of targets as they were defined. Or we hit the stumbling block of the other funders not wanting us to speak about failure of a jointly funded project. So it's difficult, right, to talk about the things that haven't worked. And we've definitely funded programs where the intention to integrate mental health into, say, a maternal and kind of neonatal program hit stumbling blocks because organizations were very nervous about the concept of assessing what the need was without having a pre-designed plan to be able to address that need, and so they steered away from it. We've definitely had challenges with funding partners being resistant to funding local organizations because of this kind of age-old kind of preconception that local organizations can't absorb a lot of cash and can't get the job done. And so you're trying to, I'll stop, but there's a few challenges. So any advice, welcome.
Yeah. Thank you so much. Just to share a few, I mean, it was a difficult question when I reflected about that to answer, but I think the first one, which is more a structural issue, is that we're in a society of project implementation that needs to go fast. Fast because we need concrete, tangible outcome fast, because the donor community needs also evidence of the relevance of the support fast, because of government may change fast. But mental health and mental well-being takes time. So we are here in a clash of, I'd say, time zones, so to say. And I think there's a whole cultural and educational component that altogether here we need to bear in mind about the fact that if we want to create genuine and sustainable impact, this will take time. And this cannot follow the same rules as per other possible relief aids sectoral support lines. So it's one. Then I cannot agree more with what you said, Natasha, about the difficulty to actually identify partners and I'd say, entities, bodies who have identified mental health as a key priority and who really give it the means it takes. Meaning, for the Ukraine response, for instance, we're extremely ready at our end to fund and support and encourage mental health projects. I made more than 20 calls with 20 different organizations. 0 of them could tell me we have prepositioned and prepared ourselves to mental health emergency response this way. It was always, don't worry, it's mainstreamed, we can extract figures, we can extrapolate. But yes, fantastic, good news, but at the same time, it means that mental health is not a priority as it can be for food, shelter, which are extremely necessary, don't take me wrong. But I think we are at a stage now where we are changing the paradigm, but there's still some mental health shyness a bit of not being ready to say, I stand up for this topic, for this cause, and this is the means I put forward. And I have challenges really to really identify partners to go this way, especially in emergencies.
Yeah, I totally agree, and I think we have to scale the mental health response because we are in kind of a crisis mode about that as well. So I'm with you on the time zone. I don't know, Joanna, if you want to jump in here at all. I know UNICEF was very active in Ukraine humanitarian settings and generally on the ground. So I don't know if there's anything you can add from your perspective about successes and failures, lessons learned, those kind of things. Oh, I think you're on mute.
Sorry, I keep doing that. Yeah, I mean, I think in terms of what we see and just working with both governments and both private sector and civil society and young people, is that collectively, obviously, we know that amongst these different actors, we have the range of expertise, resources, and convening power needed to make those kinds of outcome impact that we're looking for young people, for girls, for women, but different actors kind of have different priorities, different objectives, and also different ideas of how to achieve those objectives. And I think that's a strength, you know, not everybody has to think the same, and we bring that, complement one another. But at the same time on the ground, maybe Rabih can speak to this as well, managing that very diverse strategies and ways from a local government perspective is really challenging, you know, and needing to come together somehow to have a common ground, you know, in terms of what we're setting out to do, the priorities we agree upon, and how we're going to achieve that is important for not having this too many different ways, too many different priorities that they simply can't handle, and also that, you know, for me, we talk about it in these big terms, but if we think about a child or a young person, an adolescent, what that translates to is they're not cohesively receiving the support and the services. You know, in a country level, we might be giving to different projects and it looks good on paper, but not the same young person is being reached with that range of things that they need. And so how do we, you know, ultimately, to simplify it, make sure that the same child is receiving those range of things that they need? And, you know, how can we come together and work together on that? I think is something we can do more on for sure. And again, sometimes also back to the point of, even for myself, sometimes the more we talk to local actors, service providers, young people in their communities, the more we actually see what Rabih said. The understanding of mental health is different. The needs and the priorities are very different. And so I think from an equity standpoint, it doesn't always make sense that we have in our mind one solution or one way or one system that is going to work for everybody. And we really have to take the time to really develop those solutions and see, you know, these communities and providers as an important part of our conversations that we're having here as well in our decisions.
I think your point about priority setting is absolutely spot on. And Rabih, I wonder if I can turn to you, because we discussed this a little bit this morning, like when the need is so great and when you want to act and you have that call to action, where do you start sort of in the vast field, you know, without getting paralyzed about taking action? So you mentioned like that's a bit a difficult area to maneuver. So I wonder if you had any thoughts about that as well. on priority and need setting?
Yeah, I mean, I can't agree more with all what has been shared from either the private sector, the donor partners, and UNICEF. It's not an easy beast to tame. How do we start, and where do we start? And for those of you who may not know, for the last 4 years, there has been a momentum also globally with an interministerial summit that's happening every year. This year it's happening in Rome, where governments from across the countries, UN agencies, and some donors would meet and really define what are the priorities and how to focus even more. Again, I mean, is there one way to move forward? No. Joanna has been speaking about the strengths of mental health being interesting for different sectors, and I fully agree with that. The only issue on the field and the absence of a convening body, right? And this convening body can be different, or a governing body in different countries. Mental health becomes everyone's business and no one's responsibility.
Right.
And this is what we see on the ground. It's, especially after COVID, mental health has become really important. Everyone talks about mental health, specifically youth mental health, and you can have a wide range of intervention with very solid evidence-based or no evidence-based at all, and all of it goes under mental health interventions. We're not at a time and place where we don't know what to be done. We have a very good, solid data about what works. We know how to deliver it. We can train people and build systems to do that. But when you take all those different agendas and you come from the global level to the national level, and it trickles down to different UN agencies, different INGOs, different local NGOs, who will pull all of this together in a cohesive way? That for me remains the big question that I've seen over and over and over in many contexts, and I don't have an answer for that. But what I know is that if we don't have this synergetic space or place, things and systems will not move. We will see projects and programs going up and down, and we might be doing more harm than really helping.
Yeah, it's. I think that's it's a difficult problem also because we say that mental health is health. So it's like, is it within the health systems? In which governing body should it really sit? So I'm just going to turn back to Franzisca and then maybe ask the same question from your perspective about what success looks like to you in the work that you're doing, and then maybe also any challenges that you've been facing and lessons that we can learn from the private sector model that can be replicated.
Thank you. So challenges were, we had a lot of patients, actually, especially during the pandemic, a COVID pandemic. We have up to 100 new patients a day. That was quite challenging for us to say yes. And other challenges in Switzerland are that psychiatrists are rather rare. You cannot find them easily. It's now better because sometimes psychiatrists are practicing on their own. They quit and they join us because we have meetings together. We have this team and they like that. So it's getting a little bit better with the time. Sometimes also if you go fast, then you have to bring together all the different elements, the financial, authorization part, the team, and yeah, all in the right time. That was challenging sometimes. And success, I mean, is for me, if you can make a difference in the life of a patient, or you know that the team really does difference in the life of many patients. And yeah, somebody said not just listen to patients, but really understand what they need actually, and bring them to a better health, actually, yeah.
Amazing. So I'm going to ask a few more questions, and then I realized we haven't had that much time for audience participation, and it's kind of like a late, we're the last panel, and I just don't want people to fall asleep. So I don't know. So it would be great if you had any questions. If you do. Okay. Yeah, I'm happy to take any questions directly if anybody wants to jump in. I'm just testing whether you were, still awake and with us here. It's been a long day, so And this is particular. I think it's really important. You know, if you're, I don't know where you stand in your mental health journey or in your interest in it or are interested in acting, but I mean, these are some of the most amazing organizations and really doing innovative stuff. So, yeah, if you have any questions, please do go ahead and ask.
Yeah.
When I moved here 25 years ago, extremely difficult to find mental health
Yeah.
support and also mental health in different languages. So
Yeah.
I read in your bio that you do offer that. So how does it work in general for people here in Switzerland?
All is covered by the basic insurance in Switzerland. And we have in Switzerland, and we have international patients as well. We also we just concluded with one international insurance, a plan, so we can also have a plan for these people. Usually they come also with their own insurance, but we really treat everything, we work with the basic insurance. And we have therapists coming from everywhere in the world, so we can offer treatment in about 30 languages, different languages. We have we just did an analysis. Actually, we saw that we have about 40% of our patients coming from other parts of the world, migrants, refugees as well. So people in northern East who are in difficult situation in Switzerland. That's maybe also because we can offer this treatment in different languages. We tried, but we were told there was no need. So that's the only. Thank you for the question.
Yeah, I think Sarah wants to jump in.
Sorry, can I just jump in very quickly and thank you so much because you've reminded me to say something that I forgot to because it's slightly kind of rabbit in headlights of which of the 5,000 things you have an opinion on should you use your time to speak about. And one of my kind of like sort of growing frustrations, fairly or unfairly, but it's true, is about language, right? And about the kind of there's a current kind of movement that is about the kind of like UHC, universal health coverage, and kind of incorporating mental health into that and supporting like a global advocacy campaign, right? And the global advocacy campaign is for any kind of advocates at a kind of a global, regional, national level, which includes CSOs. It's global. The entire toolkit is in English. No other language. And I recognize that there are challenges for those that have created the toolkits, but I felt that probably spoke volumes in some ways that there is a group of people and a movement that is trying to advocate for kind of marginalized communities and marginalized members of those communities, but are behaving in a way unintentionally that is kind of creating further marginalization, which would speak to kind of Raj's, like, your kind of Eurocentric approach. Like, there's a trick to miss. So my call to action, another one, would be that if you are kind of working with organizations that are implementing approaches and you are supporting those organizations to share their learning, which I think is a massive piece that we can all do, give them a budget line to translate it.
Yeah. Very good.
Thank you for reminding me.
If I may also just add up something about implementation. I mean, the Zurich Foundation, we work closely with UNICEF and Joanna also in several countries in Latin America, in the Asia-Pacific region. And the strategies to unlock maybe the interest or the commitment from governments can take several shapes. It can be through the Ministry of Education, Ministry of Social Affairs, Ministry of Health. But I think, and Joanna, you may comment further on this, but there are really more entry point than when we think about mental health there is about. And the second aspect I observed is, in case at government level there's no interest or commitment, we can then shift the strategy and go at grassroots level and work maybe directly with schools, but also with sport clubs, for example. In many countries, there are national leagues of sports that are valuing, gender components, a sense of fair play that is also about, how you handle complexities of the societies and so on. And we engage with several sport clubs or leagues over the world, where we also work with the coaches, so that the coaches of this given sport, while they teach the physical abilities to handle a given sport, they also transfer and convey to the youth all aspects about mental health and mental well-being. So just to say, I think there are many entry points for a system change approach, and it's for us to test and share. And maybe if I can hand the ball over to Joanna also to speak maybe about the coalition we have built up together, and maybe the aspects about the ministries, that all the ministries you in UNICEF is being working with.
Sure, I'm happy to come in, Natasha. Is that okay? Or
of course, please.
Yeah, I think, that's one of the benefits. I can't say we're experts in, in this. Really, we're learning as we're going, and we're trying different things, and we're learning along the way. With this, partnership we have with Zurich Foundation, but also bringing in, other private sector stakeholders, young people themselves, NGOs, governments themselves, to really begin having that exchange on, resource is one component of it, but learning, generating evidence from the bottom up, really working in a range of countries so that we can see what works. And I think that's one thing that stimulates interest. When a government might see, okay, how did another government, do this from a systems perspective within a region or across region? There is a lot of learning that can happen. And I agree with Sofyen that there's many entry points as well. And government, by and large, we've seen a big shift. I think government is interested, but what we have to take note of is that the capacity that they have, even if they do think it's a priority, they need to be able to, for us to be able to work with them on what is feasible among the many other priorities and constraints. And again, that how we work across those, when we say government, there's many different counterparts and many different pieces of government. So how do we bring those people together as well? And, for UNICEF, one of our big focuses is working at the district level, at a subnational level. National level is very important, but at a subnational level, because that's also where, services actually get delivered and policies get translated into action for young people. And so, yeah, I think the coalition is about that. It's really, I would say, Sofyen, I don't know if you agree, it is about action, but it's a lot about learning. It's a lot about developing solutions in these contexts with local experts, with young people themselves. And, it's we're happy for more people to join, because we recognize that diversity of experiences and perspectives really is what's going to strengthen the work of this coalition, which is very focused on prevention and promotion, mental health services, and, caring for those who have mental health conditions is critical. But at the same time, we feel that the prevention and the promotion aspects are very important, because what we hear often from young people is that, a lot of them face varying levels of distress, though not to the level of disorder. And I think this also translates, if I could say one more thing about measurement, because a lot of you talked about this as well. How do you measure success? How do you measure impact? And that's actually an important point, because along mental health outcomes for children and young people, do we have a good baseline? How are we going to monitor progress? What are the key things that we're looking at? Is it simply just about reduction of mental health conditions, or is it also about, increase in coping mechanisms, increase in connectivity, increases in supports they have? What is it that we are measuring, and what kind of information do we need to see if what we're doing is having the kind of impact that we want to see, not just at individual level, but at a population level as well.
Yeah, I think that's a really important point. It's not just about surviving, it's about thriving, and really having the capacity to be your best self. Atalante, I don't know if I think you had a question, so it would be great
I did have a question. It's really, thank you so much. I think I'm more confused than I was I started, it seems like such a complex issue. I'm really fascinated by Rabih because you're working in a country which is struggling on so many levels, and without a government for a long time, and the financial system and so on. And interestingly, you are working you have created something which is actually functioning in terms of mental health. I understand very well what Sofyen's saying. There are so many different entry points, and we can work at the local level, we can work at the grassroots level, and so on. But I do think that what we need is leadership also, that all those great ideas and great actions that are happening start to become systemic, start to become part of a system. And I guess I don't know whether it's a question or a concern or what, but Rabih, can you reassure me?
Thank you, Atalanta, and I think I'll maybe bounce off what you shared around leadership. Thank you for your kind words, and I think it's never one person alone. It's always different people, different also circumstances. A lot of people in different organizations. It's a network. It takes a lot to really move a system, and I'm very grateful to have had the chance to create a space for this synergy. And speaking about leadership, I also think it's part of what can be done from the UN agencies, from donors, is to really try to identify champions at the local levels, people who may not yet be within the system, but people who from their position, their popularity, can at least start changing discourse around mental health, can make mental health a priority. And I think the best way to do that, and since we have a very, very influential group within this room, is by starting to speak about our own mental health and to encourage people around us to speak about their own mental health or the mental health of people we love. I mean, the numbers are clear. 1 in 4 people will experience a mental health condition in their life. So in this panel, we are 6. So at least one of us have or will experience a mental health condition. And I think in different capacities, just looking at this panel, we can influence a lot within our organization, within our networks and the partners that we have. I know for a long time I didn't speak about that because I haven't personally had a mental health condition yet, but a lot of people in my family has. It never occurred to me to talk about it, just to say that we are all potentially service users. We are all potentially, or some people that we love dearly, in need of mental health services. And mental health is so invisible that it becomes sometimes too abstract. And if we can push people to have faces of people they love, maybe their partner, their children, their friend, when they think about mental health, especially those people who are in power at the national level, I think we can really start to change things around.
I feel really bad, Atalanta. I didn't mean to confuse to make it so much more confusing, but it is. I think mental health is a really, really tricky area to get involved in. What I would say, which I guess is my call to action, and towards the end. Oh.
I have 2 questions from the app.
Okay, I'm good. Yeah, I'll just finish. Okay, thanks. Before I forget. This is what happens. It's like a squirrel. Boom, gone. It was a good idea. No, I think I know what I was going to say. It was about.
Call to action.
That was it, right. So we're sitting here and we're like, what can we do for mental health? And I think, and again, I don't know if your donors are working on projects or whatever, but we talk so much about the intersectoral nature of mental health. And that was something that I, as a donor, when I started doing this, I did like 8 years ago, I started funding mental health initiatives. And I really realized that it's so not standalone. And any project can benefit from having mental health funding and from taking a mental health approach. So if you are looking at specific issues on women and health, please add a mental health component. If you're looking at food supplies and nutritious food, please add some funding for mental health and add some metrics and encourage the organizations that you're working with to think about mental health, because I promise it is a virtuous cycle. If we think about people's mental health when we're working with them, I mean, all the problems in the world are, well, you know, human problems, and humans have to be at the solution of it. And to be able to do that and have the resilience and the capacity to address some of the biggest problems that this world faces, you have to take a mental health lens to it. That's what I think. So, yeah. That's my call to action.
Thank you. That's super helpful.
Oh, great.
Great.
Job done.
And that's super helpful because you answered one of the questions on the app, so that's great. That makes my life a little bit easier. The other question was around prevention, which I realized that over the space of today, it hasn't really been touched on as much as probably it could have. So perhaps each of you could just take a moment just to think about, you know, or what you would say and advise in terms of how we could put some energy into prevention of mental health issues. That was the other question.
Oh, it is. Thank you. So just quickly from my side, from a prevention perspective, one of the kind of the wish list to see, given that we fund a lot of kind of primary healthcare, is that the sensitization and the promotion and the education in the community level is as common for kind of mental health and mental health kind of resilience as it is for antenatal care, as it is for kind of vaccination coverage, as it is for kind of nutrition programs. So, and part of the way in which, with kind of thinking about how to incorporate that and standardize that, is actually to kind of take it back up a level and look at pre-service training. So pre-service training for teachers on social emotional learning, pre-service training for nurses and for midwives, to incorporate that and standardize that into their care, because you could imagine if you start that conversation with a cohort of midwife students or a cohort of nursing students, 1 in 4 of whom will be kind of suffering or will suffer from a kind of a mental health challenge during their lifetime, that may be a way to incorporate prevention and promotion from a sort of cost-effective perspective as well.
Yeah, totally fair. Also, know that's perfectly right, and I think it depends also on you know, the age and the specifics of a given group, but in general, I'd say, I mean, you know, if we don't prevent and promote, what happens? People, youth, adults or children may not have the words to actually express how they feel, and they will take it as the new norm for themselves, because they're not aware that this is something that comes from the top of the rest. And if we don't equip everyone with these abilities to have like an emotional education about how it works, and that, you know, it's okay to say I fell on the floor and my knee hurts, but it's also perfectly equally okay to say this is what I've been through and this is where I don't feel okay, and we avoid this to escalate further. And this is all about prevention and promotion. And something also we do more and more to help for this is to work indeed with schools and to integrate emotional education, mental well-being part of the national curriculums. And we have a few good practices for that already. We just started a project in Portugal, for instance. We have a few new ones coming with UNICEF. We have also several projects which just started along those lines. It's one aspect, and also campaigning with ambassadors. And we touch a bit also on that. If someone who's let's say in our case, the youth idols, and if they speak about mental health and their fragility and vulnerability, it helps to break down the silence, because then everyone feels empowered that it's a normal topic and I can speak about it. So it's all about prevention and promotion to avoid, as I said at start, someone reaches a crisis point.
I don't know, Joanna or Rabih, do you want to jump in at all and address the question?
Maybe just to add, sorry, Joanna, did you unmute? Do you want to go? Go ahead.
No, go ahead. I'll come after you.
Okay, thank you. So I think when it comes to prevention and promotion, the reason usually they're not talked about as often is that usually the evidence base for them is lower, and the time to see the results is longer. And just to join what Sofyen was happening, there's a mismatch between the appetite to fund and when do you see the results. But what we know for sure works when it comes to prevention, of course, tackling the big social determinants, that poverty, education, gender equality, sexual and gender-based violence, etc. But when it comes to more universal mental health interventions, we know that parenting supporting program beyond just training parent on parenting skills, but properly supporting them in child rearing. We know that social emotional learning programs and life skills program at schools and suicide prevention programs work and they're cost effective. So if we have to really choose where to start, I would pick those three personally as a starting point for prevention and promotion. Of course, in addition to changing the discourse around mental health and addressing stigma, and I would join here what has been also said by Sofyen in terms of really having those champions and idols share their own experiences around mental health and mental health struggles.
Definitely. I think Rabih mentioned all of the interventions we know and the important layers of this approach for prevention and promotion. Everybody has already so well articulated the needs and the response. But for me, I think prevention and promotion is just so important because we see these statistics all the time, which are very important. 1 in 7 young people have mental health condition, but we know that 10 in 10, all of us here, we all have mental health. And so the action, that's a big thing with prevention and promotion, is that you don't only take action just to stay well when something is wrong. And that prevention and promotion to me is empowering because it allows people to be part of the solution. We talk a lot about problems and gaps and all of these things, but we all play a role when it comes to prevention and promotion and being part of the solution that is. And I would just underscore that caregiver support, interventions, and that's not just parenting skills, is something that we really can emphasize and do more of. And when we talk about things like social emotional learning and life skills, we forget sometimes that, I don't know, maybe the younger generation, but like adults and caregivers didn't necessarily learn that. And so it is a challenge for them to give something to, those that they're caring for that they also didn't experience. And so also navigating caregiving in these days, there's so many things we all don't know. So I think really just looking at that as an important intervention and investment area, I think can have a huge, huge impact on mental well-being of children and adolescents.
I love what you're saying, and I also just want to highlight something that I think Rasa said, or in one of the earlier panels also, since we're talking about women's and girls as well, addressing women's health has a bigger impact than just on the woman herself, but on the family as well. So you can have this catalytic effect, the snowball effect, by addressing different areas. And I wasn't sure if there was a question, if you had your hand up. Yeah. Do we have time? Yeah. Joanna, I know you have a hard stop at on the hour, so if you need to drop off at all, just go ahead.
Thank you so much. Everything that you've just said is absolutely spot on. I'll keep it really short. I think one thing that hasn't been maybe touched on today is, and we work very closely with this, especially with suicide prevention, and all the other areas that we support in, is protection and safety. One area that is absolutely critical, especially with a lot of the women and girls that we work with, we kind of forget that, a simple thing like them sharing their story with anyone can have devastating impact on their security. And sometimes the perpetrators who inflict that mental health on that person, for them to have that, are actually people close to them. So you don't really have the avenues to share those stories, and are unable to do it in a way where people are exposed to in terms of identity. So it's really important not just to support mental health services, but the other services around it that could provide that protection and the avenue, so you can give them some form of protection or safety. I just wanted to add that because we do kind of think about that in all our programs, especially when we're signposting or providing other services. It's a critical area, and not everyone is comfortable even sharing with therapists within their community. Yeah. For example, we have therapists who speak their language and they're in the community, but actually sometimes they don't want to speak to people in their community in fear of their story coming out. So that level of trust is not there. So sometimes it is better to kind of provide a service where it is a few steps away. So just kind of considering the other services needed to provide safety and protection for those experiencing mental health as well.
Yeah, I think that's a really good point, and no, we did not touch upon that, so thank you for bringing that up. I don't know if anybody of the panel wants to address any of that, because we're coming to an end. No? Okay. So,
just at 100%.
Yeah, basically. So just to sort of round up the panel, I thought that kind of what Gaia did in the previous one, like what is the one key message and the one action that you would want the audience to take away from today's discussion?
Just one. Okay, so if I had to pick across the many, I think for me it is still about supporting local organisations and being flexible in the way in which you support them, so that the support that you are giving them doesn't just support the population they're trying to serve, but actually enables them to support their team and their staff. Because another thing we haven't touched on today is we ask a lot of the partners that we support who ask a lot of themselves as well, and we don't offer any protection or enough protection for organisations to look after their own well-being in order to kind of better serve and sustain their service. So that would be mine.
So I think I believe in the integrative approach. Actually, I think mental health care needs to have really an integrated approach. Not just there is not just one way. We need to talk together and be careful not to really to get the coherence in intervening, so the patient doesn't get lost. Yes, and I think giving women does really a good job in bringing people together. So it was very interesting for me to be part of it. Thank you very much.
Natasha, if you don't mind me interrupting, I will say my one thing, and then I have to step off. Sorry to interrupt, but you know, one action, if I could bring it back in, children and adolescents is my field of work, so I'm bringing it back to them again. But if we could just, I think, find a way to listen and try to understand and be supportive to even one young person in our life, you know, that's your child or a relative or somebody in your community or through volunteer work, you know, let that be kind of the starting point that drives us for any other further action within our sphere of influence. I think that could be one thing I would hope to leave everyone with.
Mm-hmm. Thank you.
No, but I was going to say that I used to work in emergencies in Kurdistan, in Chad, in Darfur, in Lebanon as well, as part of several emergencies, and I felt very much alone in my battle for the topic. No, but more seriously, it was really, again and again, a question of why this now? Why emergencies needs mental health at start? And the good news is that it has changed a lot since then. But my message here is that I do think it's a global responsibility. It's everyone's responsibility, because mental health does not follow one geography or one group or one demographic. There's no border to mental health, and this is why we all have a role to play at our different ends. It doesn't take, something specific, and either be that, in our family life we have a role to play, but also if we have any leverage in our hands to have a global impact, this is also our responsibility. So that's really the message I want to convey.
Rabih, you want to jump in?
Yes. I think, in addition to what I shared, I would say that I think it would really be a game changer if we start looking at mental health as an investment, not an expense. Because we know very much when we invest in mental health, we can impact so many other sectors and dimension of the person. At the end of the day, humans are making the changes in other sectors, and the person cannot find a job because they're depressed, and I'm helping them with their depression, and they can go and find a job. They're going to change their life and the life of their family. And we know that mental health intervention, although sometimes they're not cheap, they're very cost effective. What we need to have is a system approach to that, and also make sure that we're synergizing collaboration and intersectorality within the systems at the national level. And the best way to push that forward, again, is by creating a space for governance and for collaboration.
Amazing, powerful. My call to action is going to be much more simple, that you all look after your own mental health, because without it, we don't have very much. So just a call to care. And the last bit I just want to say was it would be super interesting to hear from you. I mean, we've had some incredible speakers today, so it would be really interesting to hear from you guys if you fancy getting back to Giving Women or tweeting about it, how your attitudes would change with respect to mental health after hearing the speakers on this panel and everything you've learned throughout the audience. And if there's any action that you feel that you could specifically take, either to look after your own mental health or others. And I think with that, we're done.